right?
What do you think of ultrasound? Because I've heard some crazy stuff about the ultrasounds right now. It bothers the kid doesn't like it because that's some kind of an intervention. If he can feel it, though we can't see it, but baby feels it, right? And if you do it almost once a week or once per 2 weeks, that's way too...
So ultrasound is ultrasonic, right? It's ultrasonic wavelengths, right?
Goes.
And so from a more natural birthing perspective, most midwives will say doing a 20-week ultrasound is really important, right? Doing that one to just make sure baby's intact, make sure that baby's in the right position, making sure that you don't have placenta previa or vasa previa if you're having a home birth or a birth center birth. There are certain medical situations that would prevent those healthy outcomes in those settings, right? Because midwives are not their scope isn't as big as a conventionally trained OB, right? But ultrasounds by nature are ultrasonic waves, and the research that I've been taught in, my postgraduate training is that it's actually to the baby almost like being in like a subway, like the loudness of that actually auditorily for the baby is that stimulatory to the baby's nervous system. When you learn ultrasound as a therapy, like in some physical therapy studios, they'll do ultrasound on different tissues. They teach you, like if you put this ultrasound too long, you're going to burn the tissue. What it actually does at a cellular level, it actually changes genetics and things like that.
Really?
And so as I was sharing with you earlier, that one of the most studied interventions that have relationships to neurodevelopmental challenges and brain issues in kids is actually ultrasound. But nobody's taught that, right? No mom is taught, like, oh, this ultrasonic wave hits your baby's nervous system, hits their brain, hits their eardrum, and, is kind of like a subway. We just like the picture that we see, right? Because they can print out a picture. It's 4-dimensional now. Like, there's all sorts of things that are really cool about it. I think it's phenomenal.
Well, they charge this.
I think it's amazing.
They charge your insurance. That's why they do. Let's do it.
And
every week.
It's standard of care, right? Standard of care. People think in birth that an ultrasound is no different than taking a pulse, right? It's just like taking a blood pressure. It's just ceremonial at this point. We just do it. But if you deny it, it's often like, wait, who's this person? Why don't they want what we're recommending? But then thirdly, I would say there's no informed consent at all. There's no informed consent on virtually any intervention that they do in birth, right? Like they usually just say, this is what we're doing and this is when we're doing it. And anytime, and I've interviewed nurses, sometimes staying anonymous about this, who are OB nurses who say that when a mom comes into the hospital and has a birth plan and wants to customize it as naturally as possible, there is a culture of scoffing at that. And they actually just say under their breath sometimes, oh, it's going to be a C-section. Because they don't want moms to not do what they are recommending.
This is evil.
It's insane.
This is so evil. Mom does not need a C-section, but they will schedule it?
Not that they'll schedule it. They will just assume that she will, because she wants to do things more naturally, that she's going to fail at it. It's not that they will maliciously schedule a C-section. Okay. They will, under their breath, say, she's going to have a C-section.
Oh, I got you.
Right? So it's more derogatory.
Okay.
But in my view, we had both of our babies at home, and both babies being born at home was I would say, if you're a believer, like, you don't really know God until you see your wife birth your babies with as little intervention as possible. Right? Like, and then you see them birth and they're born and then they latch and then they're placenta, and you see the whole process and you see things done as naturally as possible. And it's like, well, I already knew, right, in my mind, because I've been teaching families for 10 years before I was a dad, right? I've been in practice 15 years. My oldest is 5. Like, so 10 years I'm teaching. It's all theory, right? Because I've never had a child. Right?
Correct.
I don't birth a child, right?
You never know.
But once you see it, you're like, oh my goodness, right? It takes all of the learning, the graduate education, the postgraduate education, all of the moms that I've helped kind of go through this process, all the dads that I've kind of guided without having kids, and then all of a sudden I have my kid. It's a miracle. The less the system has to say on what your kid's outcome is, because it's more empowerment for your wife in that journey. Right?